We're back. Strength and Knowledge is back. I'm John Allan, and in this episode, Dr. Josh Funk and I discuss what it takes to become a successful physical therapy company in a field that is dominated by large corporations. Specifically, we dive into how to grow while maintaining the standard, private equity in physical therapy, and the importance of asking questions to become more marketable. Without further ado, let's get into it. Dr. Josh Funk, CEO and founder of Rehab to Perform, Division I and professional athlete turned PT and successful business owner. Welcome back to the Strength and Knowledge podcast. It's been a while since you've been on the podcast, so why don't you give a brief introduction on your story and how you got to where you are today?
Hey, everybody. It's really kind of a full circle moment. I've seen John Allan grow up in the local sports community, both through his time with siblings of mine, and connection actually through his father, who coached me at one point during my high school years. But it's awesome to have you as a guest. You've been up and coming professional. I've kind of watched your journey going through not just your youth sports years, but high school, college, and now as a professional. So it's just awesome to have you on here. I started, here like many people, playing a ton of sports growing up. Sports was largely my identity. I was very, very fortunate to be healthy and avoid anything major. Didn't have any time missed during my high school years. Didn't even know what a physical therapist was really until I got to college, and I had somebody say that I might need surgery at the end of my sophomore year in college. And that was really where PT kind of really hit home for me on an emotional level, because my physical therapist and really first mentor at the time was able to help me avoid surgery, stay connected to the team overall, show me a world of sports medicine that I didn't realize until I came home didn't really exist. And it gave me the idea for R2P. How can you bring a people-centered, athlete-centered approach to the general population, knowing that everybody is performing in one way or the other, everybody has a season that they're looking forward to, and if we get down to it, we can work on individuals' movement health with competency, capacity, conditioning as a part of their process, and focusing on real health protective metrics that ideally put them in a situation where they've reduced risk of re-injury, rather than more of a protocol-based, a little bit more medicalized, symptom-focused approach that I had unfortunately experienced after my sophomore spring season and came home during the summer. And I was like, how can these two things possibly be under the same umbrella from a professional standpoint? So that being said, we're a little over 11 years in here at our third office that we opened just before the pandemic. Honestly, right around this time period, Memorial Day weekend was when we opened in 2019. So it's really, really cool to be sitting in here, having it thriving. I think it really gave us confidence, not just to have the second one work really, really well, but the third one also do really, really well in the 7 or 8 months before the pandemic really hit hard. But, your memories of, honestly, I might even have painted this wall with Zach, being a little bit of, just a sentimental experience, again, being here with you, being at this office, and seeing all the cool things that I felt like we've done over the 11 years that R2P's been in business.
Awesome. Thank you very much for that introduction, and we'll hop right into it. We're going to talk about the business side of the PT profession. So if you've been paying attention to anything in the PT world, you've watched private equity really buy our profession. But R2P is growing. It's growing at a very rapid rate as well. So just for the viewers who are unaware, what even is private equity and what's actually happening with private equity in our profession right now?
To oversimplify this, and it's not to say that this is all situations, but usually when people associate the word private equity with healthcare, it is largely involving non-providers in provider spaces. So you have non-providers owning the businesses that providers are working in. They potentially view it as a beneficial transaction, right? It's a good business. There's a certain amount of stickiness. We don't necessarily have what's called recurring business, but we have reoccurring business. If somebody chooses R2P and they have a good experience, the likelihood that them or a family member is coming back to us is very, very high. So there's a stickiness associated with it, probably leading to something that they would call lifetime value of the customer that has a lot of meaning from a business economic standpoint. When you have non-providers in provider spaces, you might argue that the focus might get lost, that the wrong things might get prioritized. Some buzzwords or oversimplified ways of communicating that might be that you have bankers focusing on spreadsheets in healthcare as opposed to providers focusing on patients. So for us, we are an independent owned company. We have not done anything with regards to even as other PT practices have done, involving ourselves with groups that are potentially like multidisciplinary physician practice groups. There's been issues with POPs with regards to having another healthcare profession own us. But in the situation with private equity, you're talking about people that potentially aren't even, and a lot of the times aren't even healthcare providers. So again, focus on the wrong things. You have maligned incentives. You have people that are viewing patient care solely as the amount of money that could be potentially squeezed out of the ecosystem. And you could also argue that probably you're losing your directionality of what really matters for that particular company.
As a clinician in the ecosystem that you've created, why does this matter to me? Like, what does this mean for me as a clinician, me as someone who wants to progress up through the company and things like that?
I think this is going to go probably two different directions. One, you're going to be in a situation that's probably going to be less on an end of the spectrum as it relates to productivity. If we are talking about maximum value as it relates to returns, let's say I buy into a company, I'm a private equity-backed company, and I buy in. I'm going to expect certain returns, and I need to do things to squeeze as much juice out of the fruit as I possibly can. In order to do that, well, from an economical standpoint, one of the biggest ways that I can do that is just force every single person working in that ecosystem to do more, right? I can increase their utilization. I can make them more productive, especially in a situation where we know we can only bill so much for the time that we're actually with people. In a situation where you have a more provider-led ecosystem, you probably have a little bit more of an appreciation that there is a Goldilocks effect, right? There is a bell curve with regards to we can work X hard and have Y outcomes still be something that is very, very meaningful for both patients and clinician alike. We want to have a business where the work is great, where it's exceptional. We could all argue that if you probably do more, at some point there is going to be a cost to doing more. More is not always more. More gets to a point where we talk about wanting to be optimal. It's much like a lot of things in life, right? We can express emotion for a particular situation, but if that emotion potentially drags on, how much does it potentially take me away from something? I could work really, 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 really hard, but there's diminishing gains at some point in time, right? I could be doing certain things from a weight room standpoint. I could be doing certain things in terms of getting reps. At some point in time, more, again, is not more. So in the provider-led ecosystem, we want to believe that there's a Goldilocks effect. I think you can have providers a little bit more in tune with where that kind of sweet spot is. For us at R2P, and Google made this famous a while ago, but more of like an 80-20 rule, right? So we're under the belief that we can shoot for targets and incentives largely around 80% productivity. The other 20% largely are things that fill up the cup of the provider, right? Things as simple as lunch or meetings with other individuals that they might be working with at their office or at other offices, in services, training, or, hey, even just having potentially a half hour to kind of catch your breath and catch up on notes. So the providers being at the center of a business ecosystem, I think largely leads to the best of both worlds, where patient outcomes are exceptional. And when we talk about things like workplace wellness, those are also exceptional. Then if we go to the second side of the coin for that discussion, we would rather incentivize our providers to be more like entrepreneurs or clinician CEOs. We open offices largely based off qualifying people in our ecosystem and saying, hey, so-and-so has shown an affinity to do three things: build, lead, and even sell. And they're most likely deserving of an opportunity that we allow them to then open an office with us. When people open an office with us, there are certain things that benefit them as it relates to health insurance premiums and profit sharing at that office. So it keeps the money in the provider's hands, as opposed to the excess that does get created. And every business needs to create a profit to be successful, to thrive, to be able to weather storms like a pandemic. But those providers then benefit from the disproportionate work that they might have put in to get that clinic up and running.
Yeah, it seems like productivity seems to be the only thing being measured in these business-owned private equity PT clinics. Here, it's clearly valued that we're looking for more than just productivity. We're looking for, are you a good teammate? Are you able to lead people like you've been saying? And that also takes the weight off someone's back, that they're not forced to really, really go after these numbers. They're able to kind of, like you said, chill out a little bit, enjoy that true balance of life, doing things that they love, either strength training, being a leader in the community, running especially. I know we've been doing a good job in the running community, really emphasizing that it's important for the clinicians to follow their passions and build their ideal clientele. And I think that's a unique thing that R2P has done that's not very as common in the other like business-owned private equity. So how did you do it? How did you build R2P in a way that you don't sacrifice quality of care, but you also value that patient experience as well as clinician experience?
I think a big thing is just reminding yourself why you started. I mean, I didn't get into this with finances or economics at the central focus of what it is that we were trying to accomplish. I saw how good a sports medicine experience could be, and I wondered why it was not provided to the masses. So R2P at its core was designed to be a disruptor and to ideally be a market leader. You get to be a market leader by doing a lot of things well, not just extracting all of the potential financial value out of the business for a transaction. You used the word ecosystem earlier, and that is extremely important. If we focus on any one area of the ecosystem, we might have only certain trees thrive or certain animals thrive, and at some point that ecosystem is no longer balanced and it's no longer thriving. So when we talk about what R2P wants to be, we want it to be the best consumer brand in addition to clinician brand. I didn't mention financial brand, but if you focus on the consumer and you focus on the clinicians, you can run a really, really successful, thriving business that can benefit a lot of different people. When we get back to that earlier topic of people coming in here and being able to insert themselves in a wide variety of different things, I would say that safely that we have three almost kind of subtypes of people that work at R2P. You have people that work really hard, right? Really hard. They do what's asked of them. They are hitting targets from an objective standpoint, from a subjective standpoint. They're doing a lot of things that warrants acknowledgement in the company ecosystem. You have another tier that probably does like 10% more, right? And we have certain incentives in place for those individuals as well, whether or not that's educational tracks or potentially just allowing them to earn more as a result of certain objective metrics. And then beyond that, you have your entrepreneurs, right? Those are the people that really want to give discretionary effort, and the key area there is in the biz dev side. So you have something for everybody, and as long as you have something for everybody in those three different areas, you can have synergy, right? We don't need everybody to be the hard-charging entrepreneur that wants to open up locations. Obviously, it's great when that happens because that allows us to continue to move forward, but any high-functioning team largely has a good contrast of the individuals in the room. So for us, thriving ecosystem, again, it gets back to balancing consumer brand and clinician brand. It goes to understanding what kind of people you're attracting to the company. It understands you understand that you're not trying to put every square person in a round hole, and that you need to have different options for the individuals. And ideally, as a result of that balance, you're able to continue forward and maybe grow at a rate that maybe makes some people uncomfortable. But we feel very, very strongly that this is intentional and controlled growth that has not steered us away from originally why we started the company.
Yeah, you hit on my next point is R2P is not just growing, but it's growing at a very fast rate. Do you have any insight on kind of matching that velocity-based growth to also making sure you're still ensuring successful growth as well?
Yes, and this is where I get into solely some of your North Star metrics from a directionality standpoint. If you look early in the business, you're looking obviously at some of your baseline metrics. You're talking about Net Promoter Score. That is considered a gold standard metric of customer loyalty. It also is tied to word of mouth referrals. You could talk about patient churn, which is an issue everywhere. We really want to get people to 4 visits because if they get to at least 4 visits, we are under the belief that they are significantly more likely to have a mutually agreed upon plan of care. Somebody chose PT, we want to get them to the finish line. And if we don't get them to the finish line, they're potentially choosing something like injections, surgery, or prescriptions. Obviously not what we're looking to do as a conservative healthcare provider. Then if you're talking about things like Google reviews, you're talking about things like staff retention, those are things that definitely hold weight. We could get into looking at outcomes measures and ensuring that our outcomes measures are not just better than the standard industry norms, but also just on par with where we've been. And we've been able to grow over the past 6 to 7 years pretty quickly. And I mentioned that because in 2019, the beginning of the year, we were only a 2-location business. Really up until July 2021, we were a 4-location business. We should be somewhere around 17, 18, 19 by wintertime next year. And you're talking about just making sure that you're holding yourself accountable. And we can say we're concerned about company culture and we can say we're concerned about clinical excellence. I would say every single year we do things that are tangibly different with regards to raising the floor or limiting the guardrails. But it's a whole nother thing to hold yourself objectively to it. And when small things pop up, either amongst providers or amongst locations, then you're getting on top of it quickly. And what are you doing? You're building more things to ensure that there's less variance or that the floor is underneath them, supporting those new people as much as possible.
Yeah, definitely making sure that you have those guardrails, like you said, is something that you definitely do a great job of ensuring that success is continuing to happen at no matter what rate you choose to go at. So definitely appreciate you hitting on that point. So one of our last points I want to kind of wrap up with is, like, for most of the listeners, this is like the first time hearing a lot of this information. They probably, like I said at the beginning, they didn't even know what private equity was. So what is your suggestion for every PT in the audience to actually do with this information? How do we apply this to either our next job, our current job, or if we are looking to get into the business side of things, what is our next step?
I would say your best next step is probably just to ask more questions. Get more competent or literate surrounding business. I had a really, really good conversation with a DPT student yesterday at our Germantown office. It was largely just surrounding billing. How can you get educated so that you can better involve yourself wherever you end up and make sure that you're contributing to some kind of new baseline? But without information, it's hard for you to get involved, get engaged, ask the right questions, make meaningful change, or potentially in some situations you realize that you're also in the wrong spot. So when it comes to your first job, when it comes to clinical rotations, grab somebody that might be there. Ask them questions. Ask how things work. Everybody wants to get paid more, even if you don't want to be a business owner, but if you don't understand the mechanics involved with revenue generation and how that might also parallel other industries, because a lot of what goes on in our world is not necessarily that unique with regards to revenue generation and a service provider then receiving compensation, it's hard for you to really play the game. And you might be focusing on the wrong things. You might have been told bad information. The more exposure you have to getting information a lot of different places, I think really allows you to be more empowered to ideally, continue to be part of positive change. Yes, there are a lot of things in the industry that we want to continue to improve upon. There are a lot of things professionally speaking that do need attention. But I'm a big believer in control the controllables, and the number one thing that you can do is to be a more impactful, insightful, and contributing member of any business ecosystem that you jump into. And a lot of that involves you, yourself kind of doing the work. And I know there's not a lot of business stuff in DPT school. You have a limited amount of time, limited amount of resources. So go and do the work on your own, make it happen. And ideally, even if you end up leaving whatever place you're at, make sure that you leave it better than you found it.
Thank you very much for your time. And if there's no other concluding thoughts, I appreciate it again.
Thanks, man. Awesome to have you on here. Excited to see where this thing goes.